Dr. Singh, please tell us about recent advances such as the 3D cone beam CAT scan imaging technology and the ability to perform minimally invasive surgery for placement of dental implants.
Yes, first of all, we were very excited to have the cone beam CT technology. We're one of the first offices in Ontario to have been approved for it. And so it represents a tremendous advancement in what we can do. Previous to having a cone beam technology, we would be able to have imaging that was still imaging. We would send the patient to a radiologist, have a CT scan done. It would be sent back to us as various still images, and we would use that to analyze the sites that we were proposing for the bone, look at the bone, make sure we knew exactly where the nerve is, make sure there was nothing else, no pathology in the area, there was nothing that would preclude the placement of an implant. Then we would go in and do the traditional surgery. We'd actually open the gum tissue up and place the implant based on measurements that we had gleaned from the printed CT scan images. So it gave us an idea of what was there, but essentially we were placing it by hand and placing it approximately into that area as accurately as we could freehand. With the advancements of the 3D technology, it allows us to import the CT images directly into planning software. Using that software, we can virtually place the implant, meaning place it in the software exactly where we want to place it. So that allows us to avoid nerves, to avoid other roots or important structures, and to center it as much as possible within the available bone for ideal placement. Now, once we've planned that on the computer, we are then able to transfer that planning into a guide, into a surgical guide that we use at the time of surgery. What that means is, instead of having to do a normal incision, which is opening up a bigger section of the gum tissue, we're now able to just simply go into the area that we're looking for, take a little 4 millimeter or so opening of gum tissue, donut of gum tissue out, place the implant right through there to the exact position that we previously planned. Therefore, there are no sutures and stuff involved. The post-surgical sequelae, meaning swelling, bruising, etc., are virtually non-existent, and there's very little discomfort because there's very little invasiveness of it. It's tremendous advancement, and it's made possible by the 3D cone beams scanning technology and the software that goes along with that.